Okay, now let's talk about the minimal change disease, which is the type of nephrotic syndrome, as I said earlier. So, okay, minimal change disease is also called the lipoid nephrosis. Okay, from the name mini, I memorize that this is the most common cause of nephrotic syndrome in children, and this is very important. So, I will give it a star. That this is the most common nephrotic syndrome in a children. Okay, now let's go through the causes of minimal change disease. So for the causes we have a common mnemonic is I. So remember, it may be idiopathic, it may be due to the recent infections, it may be due to the immunization, and it may be due to the immune stimulus, and remember it may be due to the secondary to the lymphoma like Hodgkin lymphoma. So remember, this is the causes of minimal change disease. Okay, now let's talk about the main point. Actually, what I mean from the main point, the main point, this is the point when we have a scenario type of question, then we will pick this type of question on that point. So again I will give the star to this point. Actually this is 3 point. So remember, what will be there on light microscope, what will be there on immune fluorescence, and what will be there on electron microscope when a patient have minimal change disease. So the first one, on electron and light microscope, there will be a normal glomeruli. The glomeruli will be look normal, and there will be a lipid may be seen in the proximal convoluted tubular cell. Actually this is also important, but this one is more important. There the glomeruli will be look normal on light microscope. What will be there on immune fluorescence? On immune fluorescence, the immune fluorescence will be negative. Why? Because there is no immune complex deposition in minimal change disease. So okay, what will be there on electron microscope? This is again very important, so I will give it a star. There will be a effacement of the podocyte food processes on electron microscope as shown in the picture. The next one is more visible. Look at that. This is the basement membrane. This is the podocyte food process. Actually it look like that, but here look at it. Okay, this is important. Again remember, normal glomeruli and light microscope, immune fluorescence will be negative, and on electron microscope there will be effacement of the podocyte food processes. Okay, note, remember that the minimal change disease give a good response to the steroid. This is also very important, that the minimal change disease give a good response to the steroid. So okay, now let's go through some MCQs. Okay, this is the 7-year-old girl. So remember, as I said, minimal change disease is most common in children. So this is the main point. Present with the puffiness around her eye, again edema will be there. The examination showed the BP of 100/60. The lab shows serum creatinine, urine nitrogen is normal. Okay, the urinalysis show the 4 plus protein. Okay, from this I got this is the nephrotic syndrome. Actually this is the nephrotic syndrome. Okay, no blood glucose or ketone will be there in urine, only proteinuria is there, which is 4 plus. Okay, 24-hour results show this, there is a 3.9 gram proteinuria, which is greater than 3.5. Remember, the children condition improve after the course of corticosteroid. Again the most important, as I said, I will give, this is important, this is important, this is important. But remember, from these I got this is the nephrotic syndrome. From this, that improve with corticosteroid. I got the patient have minimal chance disease, and also this is a child. So epidemiology goes there. This is the minimal chance disease. So what will be the option? The right option is the nephrotic syndrome due to the minimal change disease. Pretty easy. Okay, the second MCQs. So there is a 4-year-old girl present with the pitting edema. Further investigation show the hypoalbuminemia and lipiduria and the 3.8 gram proteinuria. So again this is greater than 3.5 gram. Okay, so remember from these 3.8 gram lipiduria and hypoalbuminemia and pitting edema, I got this is the nephrotic syndrome. And epidemiology show that this will be the patient of minimal chance disease mainly, but it's not confirmed. So describe the pathophysiology. So when you look at the options, all the options these and these are wrong, which is not related to the nephrotic syndrome. The only right option is D, which is related to the nephrotic syndrome. And remember what this called dearrangement of glomerular capillary walls. Simply it's said the effacement of podocyte food processes, dearrangement in the glomerular capillary wall.